some who believe that we monitor water quality to protect the water itself, regulating to seemingly arbitrary water quality standards. Some believe that we monitor solely to protect endangered species and their habitat. For our own good, we mustn't lose sight of another type of habitat protection. Two cornerstones of environmental protection are the assurance of safe drinking water and clean water for fishing and swimming. What we're talking about is healthy waters for healthy humans. Around the turn of the 20th century, advances in environmental epidemiology and environmental engineering led to historic declines in U.S. deaths from waterborne illnesses. One need only look at the death rate due to unsafe water, inadequate sanitation, and poor hygiene in underdeveloped countries around the world today to appreciate the protection afforded us here. Let's see if I can... Here we go. This webinar will discuss the public health significance of maintaining safe drinking water, healthy stocks of fish and shellfish, and clean water for recreation as well as for agricultural uses. This webinar will introduce water quality professionals to the agencies and associations of public health. This webinar will describe some water quality monitoring programs that interface with public health. Water quality monitoring is important to assure clean and safe water for the benefit of health. Participants can expect to gain another tool to reach for when asked by their stakeholders, why should I support water quality monitoring? Healthy waters for healthy humans. In the grand scheme of things, the planet is more resilient than its human population. It's in our best interest to be good stewards of our natural resources and recognize that maintaining a balanced and healthy environment is essential to the health of the people. The Clean Water Act instructs states to adopt water quality standards to protect public health or welfare and enhance water quality. As stated in the Code of Federal Regulations, each state must designate appropriate water uses to be achieved and protected. The classification of the waters of the state must take into consideration the use and value of water for public water supplies, protection and propagation of fish, shellfish, and wildlife, recreation in and on the water, agricultural, industrial, and other purposes, including navigation. In no case shall a state adopt waste transport or waste assimilation as a designated use for any waters of the United States. Let's discuss the public health significance of some of those designated uses. Drinking water is most immediate to most people, yet most of us take drinking water for granted. It took the U.S. decades to establish safe drinking water for citizens served by public water supplies. Thanks to public health efforts, 89% of the world's population now has access to a protected source of drinking water. This meets the World Health Organization goal to cut in half the number of people without sustainable access to safe drinking water. However, 780 million people worldwide still do not have access to improved water sources, and an estimated 2.5 billion people, half of the developing world, lack access to adequate sanitation. In the 48 countries designated as the least developed by the United Nations, the majority of people have not benefited from investment in water and sanitation. In those countries, 1 in 4 people practice open defecation, and 1 in 10 use untreated surface water for drinking and household use. The numbers are even higher in rural areas, where 14% of people rely on untreated surface water sources, and almost a third practice open defecation. 88% of deaths due to diarrheal illness worldwide are attributable to unsafe water, inadequate sanitation, and poor hygiene. These diarrheal diseases, such as cholera, kill more children than AIDS, malaria, and measles combined, making diarrheal disease the second leading cause of death among children under 5. And so it was in the U.S. that advances in environmental epidemiology and engineering in the late 19th and early 20th centuries led to a historical decline in mortality rates. The identification of contaminated drinking water as a source of major epidemics, and the influence of clean water technologies, filtration, and chlorination on mortality in major cities during the early 20th century was profound. The adoption of filtration and chlorination was responsible for nearly half of the total mortality reduction in major cities, 3/4 of the infant mortality reduction, and nearly 2/3 of the child mortality reduction. This chart shows the change in typhoid fever mortality relative to the year in which the majority of the citizens of Cincinnati, host for the 2014 National Water Monitoring Conference, began benefiting from drinking water treatments with filtration and chlorination. Typhoid happens to be the waterborne illness with the best statistics kept for that time. In 1900, the ratio of diarrheal disease deaths to typhoid fever deaths in studied cities was 3-to-1. Rough calculations suggest that the social rate of return to these technologies was greater than 23-to-1. That is, $23 benefit from improved public health was realized for every dollar spent to improve public water supplies by adopting filtration and chlorination. That's quite a good deal. Community water fluoridation prevents tooth decay safely and effectively. Water fluoridation has been named one of 10 great public health achievements of the 20th century. The effectiveness of community water fluoridation in preventing dental caries prompted rapid adoption of this public health measure in cities throughout the United States. As a result, dental caries declined precipitously during the second half of the 20th century. The mean number of decayed, missing, or filled permanent teeth among 12-year-olds in the United States declined 68% from 1966 to 1994. But we're not out of the woods yet. This figure shows the number of waterborne disease outbreaks associated with drinking water that were reported in the United States during 1971 to 2008 by year and cause of disease, or etiology. A total of 818 outbreaks were reported during 1971 through 2008. Outbreaks are defined as events where two or more persons are linked epidemiologically by time, location of exposure to water, and illness characteristics, and the evidence implicates water as a probable source of illness. Let's take a closer look at the most recent data. This figure shows the percentage of drinking water-associated outbreaks that were reported in the United States during 2007-2008 by predominant illness and cause. Acute gastrointestinal illness was associated with 61% of the 36 outbreaks. Acute respiratory illness was 1/3 of the outbreaks. Viral hepatitis and illnesses, conditions, or symptoms affecting the skin with 3% each. The 36 drinking water-associated outbreaks caused illness among at least 4,128 persons and were linked to 3 deaths. Akin to water quality monitoring, we can use public health monitoring of waterborne illnesses to help figure out the source of contamination. This figure summarizes the types of deficiencies or water system problems linked to drinking water-associated outbreaks. Of the 37 reported deficiencies, 58% were due to problems with water treatment or distribution, 35% with problems originating in building plumbing, and 5% had insufficient information for proper classification. 7 outbreaks were associated with improper water treatment. 13 were associated with contaminated groundwater. 19 of these 20 outbreaks, or more than half the total outbreaks, were associated with groundwater systems. This highlights the need for continued focus on source water protection, adequate disinfection of groundwater sources, and monitoring to assure both are happening. Legionella outbreaks account for 1/3 of all drinking water-associated illnesses in 2007 and 2008, and 92% of all deficiencies that occurred outside the jurisdiction of regulations or water utility management, making this a serious public health issue. 9 out of the 12 Legionella outbreaks were detected in healthcare facilities where patients or residents are at increased risk due to advanced age and/or underlying medical conditions. Legionella often colonized biofilms and protozoa found inside large and complex hospital plumbing systems. This protects Legionella from biocides and temperature extremes and allows the population to grow to levels high enough to cause illness. More attention is needed to understand Legionella ecology and pathogenicity, analytical methodology and capacity, and intervention strategies to prevent ongoing disease. federal drinking water regulations have focused on surface water sources due to the role of contaminated surface water in disease outbreaks, identification of surface water system improvements, and the large percentage of people served by surface water systems. These regulations likely contributed to the decrease in surface water-related outbreaks over time. Similar regulations for groundwater systems weren't enacted until 2006, when the groundwater rule was introduced to identify problems, protect wells and springs from contamination, and provide disinfection where necessary. When fully implemented, we should expect to see reduced disease outbreaks associated with groundwater. An estimated 15% of Americans, or about 45 million people, get their water from private groundwater wells that are not subject to EPA regulations. Private groundwater wells can provide safe drinking water. It is the responsibility of well owners to test, maintain, and treat their well. Failure to do so can lead to bacterial or viral illness or other acute illnesses like blue baby syndrome, which is caused by high levels of nitrate. Long-term exposure to contaminants in groundwater contributes to chronic diseases, including cancer. The U.S. Geological Survey's National Water Quality Assessment Program, or NAQA, is designed to describe the quality of U.S. streams and groundwater, describe changes over time, determine how natural features and human activity affect water quality, and describe where changes are more pronounced. NAQA studies included over 3,000 samples from domestic and public supply wells. More than 20% of the wells contain one or more contaminants at levels above human health benchmarks, which were defined as either EPA maximum contaminant levels, or MCLs, or USGS health-based screening levels. It is important to note that 43% of the contaminants included in the study have no such benchmarks due to insufficient toxicity information. This includes contaminants detected in up to 35% of the public supply wells. Continued development of health benchmarks is needed, as is continued monitoring for emerging contaminants. 3/4 of the wells sampled had contaminants from natural sources. These contaminants included arsenic, manganese, strontium, boron, fluoride, radon, radium, uranium, and gross alpha particle radioactivity, and were found to exceed health benchmarks in up to 19% of the wells, depending on the contaminant. Regional patterns in these contaminants reflect a geographic distribution of natural sources. Contaminants from man-made sources, most notably nitrates, pesticides, and volatile organic compounds, were found in nearly 2/3 of all wells. These contaminants were present in concentrations above health benchmarks in less than 3% of all wells, with the exception of nitrates in domestic wells, which were found above the MCL of 10 milligrams per liter in 4.4% of all wells. Nitrate occurs naturally, but elevated levels usually come from man-made sources like fertilizers, livestock, and septic systems. When domestic wells were categorized by land use, 25% of the 400 wells in areas of relatively intense agricultural use showed nitrate levels exceeding the MCL. That's 25%. Total coliform bacteria were detected in 1/3 of domestic wells sampled. Total coliform bacteria are not necessarily harmful themselves, but indicate that the conditions are right for the presence of harmful bacteria, viruses, or parasites that can occur in feces and cause illness. The wells that had microbial contaminants tended to be located in aquifer materials that are porous and fractured, meaning the contaminants are more likely to infiltrate wells. Contaminated wells also tended to draw from shallow depths, tended to be older, and located in relatively more intensive agricultural areas. Contaminants found in all wells were usually present as mixtures. This is a concern because the total toxicity of a mixture can be greater than the toxicity of any single contaminant. Around 80% had mixtures of multiple contaminants present at levels of at least 1/10 of individual health benchmarks. The most common natural contaminants in these mixtures include arsenic, strontium, radon, and uranium. The most common contaminants from man-made sources found in mixtures include nitrate, chloroform, atrazine, and the degradate diethylatrazine. Wells with the most complex mixtures tended to be found in unconfined aquifers more vulnerable to surface contamination. A subset of public supply wells were sampled both at the supply source as well as at the finished product. concentrations of organic contaminants were generally similar in these paired samples, with the exception of disinfection byproducts being higher in those systems undergoing disinfection as part of the treatment process. Disinfection is a primary form of water treatment for 3/4 of groundwater-supplied public water systems and isn't designed to reduce organic contamination. This highlights the importance of groundwater protection. These studies confirmed that wells most at risk for contamination are those in unconfined aquifers, and particularly those under the direct influence of surface water. But it could be worse. Imagine your private drinking water source as an unfiltered surface water source, like a lake, pond, stream, or even irrigation canal. The topic of emerging contaminants touches all of the uses of water. Emerging contaminants found in water include human and animal pharmaceuticals, personal care products like sunscreen, DEET, antibacterial soap, and synthetic musks, chemicals used in industry like flame retardants and steam-resistant coatings, chemicals used in agriculture like pesticides that act as endocrine-disrupting chemicals, and even human waste products like caffeine, cotinine, and cholesterol. National and regional studies have generally detected these contaminants in source water, treated drinking water, and treated wastewater, but the full extent of occurrence is unknown. Concentrations are usually measured in parts per trillion. Some research has raised concerns about endocrine disruptors and antibiotics. Some of the concern about endocrine disruptors in drinking water comes from documented abnormalities in fish exposed to disruptors in lakes and rivers. Abnormalities include reduced testes size in male fish, lower levels of estrogen in female fish, ovarian tissue found in male fish gonads, and up to total population collapse due to decreased reproductive success. Significant abnormalities and effects of contaminants on animals can be an indicator of similar effects on humans. In addition, some scientists are concerned about antimicrobial resistance resulting from interactions among chemicals, genes, microbes, animals, and humans in the environment. There are persistent uncertainties surrounding the human health effects of exposure to chemicals, whether emerging or not. Many human health benchmarks are based on exposure to high doses. For instance, pharmaceuticals have an established acceptable daily intake, which is how much a healthy adult of normal weight could ingest and not have an adverse health effect. This dose is developed by manufacturers when testing the effectiveness and safety of a therapeutic dose of the drug. This dose may not take into account less obvious non-therapeutic effects of exposure to doses much smaller, such as those found in water. There are also complications in comparing an acceptable dose for a healthy adult to effects on sensitive subpopulations such as infants, the elderly, and those with chronic health conditions. Even less is understood about the effects of in utero exposure and the possibility of transgenerational effects. Also, simultaneous exposure to multiple contaminants could have an additive or an interactive effect, but this is extremely difficult to determine with certainty. We know that water quality is important to the success of our native fish and shellfish. This means both greater opportunities for sport harvest and greater diversity and quality of protein for those depending on fish for their diet. Fish and shellfish contain high-quality protein and other essential nutrients, are low in saturated fat, and contain omega-3 fatty acids. A well-balanced diet that includes a variety of fish and shellfish can contribute to heart health and children's proper growth and development. So, women and young children in particular should include fish or shellfish in their diets due to the many nutritional benefits. At the same time, we know that some populations of fish and shellfish present more risk than usual. Fish advisories are issued when contaminants are present at levels of concern. Most advisories are related to the presence of mercury or PCBs. Young children and unborn babies are the most susceptible to mercury contamination and its health effects. Mercury can damage the developing brain and nervous system, which can lead to lifelong behavior and learning problems. Medical authorities suspect prolonged exposure to small doses of PCBs can contribute to a variety of human health problems, including developmental problems in children, liver damage, and various forms of cancer. Ciguatera fish poisoning is an illness caused by eating fish that contains ciguatoxin or mytoxin, produced by a type of marine algae. The toxin is most commonly found in large predatory tropical reef fish. Ciguatera generally resolves itself but can result in serious illness. The classical neurological symptom for ciguatera is reversal of temperature perception. So hot is cold and cold is hot. Ciguatera is one of the most common forms of seafood intoxication, with an estimated 20 to 50,000 cases occurring annually worldwide. Shellfish algal toxin poisonings are rare, on the order of 30 cases per year in the U.S. It is important to note that toxin poisonings, including ciguatera, cannot be cooked out of the fish or shellfish. Paralytic shellfish poisoning is caused by saxitoxin, produced by algae associated with red tides. Saxitoxin concentrates within certain shellfish that typically live in the colder coastal waters of the Pacific states and New England, though the syndrome has been reported in Central America. In cases of severe poisoning, muscle paralysis and respiratory failure occur, and in these cases, death may occur in 2 to 25 hours. Neurotoxic shellfish poisoning is caused by the dinoflagellate Carenia brevis, producing brevetoxin that occasionally accumulates in oysters, clams, and mussels from the Gulf of Mexico and the Atlantic coast of the southern states. As in ciguatera poisoning, some patients report temperature reversal. Amnesic shellfish poisoning is a rare syndrome caused by domoic acid made by diatoms of the Pseudonychia species and is concentrated in shellfish such as mussels. In severe poisoning, seizures, paralysis, and death may occur. Diarrheic shellfish poisoning is caused by oxalic acid, which produces incapacitating gastrointestinal symptoms, which resolve in a few days. Vibrio infections are estimated at 5,400 cases each year in the U.S. For most people, the symptoms are similar to those from diarrheic shellfish poisoning. In people with weak immune systems, blood infections can result in severe and life-threatening illness. Fortunately, Vibrio and other bacterial illnesses are preventable by ensuring that the shellfish you eat are thoroughly cooked, even when dining out. Eating raw oysters or clams with hot sauce or while drinking alcohol does not destroy the bacteria. Livestock and crops with higher quality waters enjoy greater yields, leading to food with greater nutritional value and flavor. The use of poor quality water can expose farm workers to inhalation of contaminated spray. Livestock can suffer illness and mortality due to contaminated water. Contaminated crops can lead to illness outbreaks among consumers. Cyanotoxins are suspected to accumulate in the edible portion of some produce. Contaminated water, sick livestock, improper food handling, and poor hygiene can cause foodborne illness. It's beyond the scope of this presentation to provide further details. Many, but not all, of the hazards faced by folks playing in the water are the same presented by drinking untreated surface water, namely exposure to bacteria, viruses, and parasites. There are other challenges. This photo is an early documentation of Oregonians apparently enjoying a walk through the surf. The smiles are, in fact, grimaces induced by hyperthermic rigor mortis, the chain of hands tragic evidence of consecutive failed rescue attempts. In addition to hypothermia, rolling logs, sneaker waves, and the wayward shark present unique hazards to the Oregon beachgoer. In warmer waters, swimmers may experience swimmer's itch from exposures to parasites or skin infections from exposure to Vibrio species. In the Gulf Coast and the southern Atlantic shore, where Carenia brevis is abundant, exposure to brevetoxin can lead to irritation of the eyes, nose, and throat, as well as coughing, wheezing, and shortness of breath. People with existing respiratory illnesses like asthma can be impacted up to a mile from the shoreline. Cyanobacterial harmful blooms, also known as harmful algae blooms, or HABs, are gaining attention due to impacts to recreation as well as drinking water. Not all blooms are harmful, but some produce toxins that can cause illness in humans and animals. While all have the potential to cause skin irritation, depending on the toxin, they can have long-term impacts on the liver or nervous system. Acute cyanotoxin poisoning can result in serious illness or death. Livestock and canines are most likely to be so exposed, but caution must be practiced for children and other swimmers with underlying chronic health conditions. Let's take a look at the surveillance summary for recreational waterborne disease. Recall the decreasing illness trend in drinking water? Here we see the opposite, with the increasing acute gastrointestinal illness as a leading cause. Let's take a closer look. Here we see illnesses associated with treated water found in pools, spas, and interactive fountains are on the rise. Although treated recreational waters are not a concern from the perspective of environmental water quality monitoring and regulation, you can see that it is of concern to public health. The figure on the right shows that acute gastrointestinal illnesses in treated recreational waters are predominantly caused by transmission of and exposure to cryptosporidium, which is able to survive in properly chlorinated recreational waters for more than 10 days. Cryptosporidium has an incubation period of about a week, meaning swimmers could be transmitting the parasite among multiple recreational facilities. Add to this swimmers who swim while ill, swimmers who don't rinse beforehand, and young children's accidents in the pool, and you have the potential for community-wide disease outbreaks. In 2007 and 2008 alone, acute gastrointestinal illness outbreaks resulted in 12,477 cases of illness that we know about. It kind of makes me want to take my chances in the frigid Oregon surf. But the figure on the left shows 64 outbreaks in untreated recreational waters caused by exposure to a variety of parasites, bacteria, and viruses. 2007 and 2008 surveillance data also included 15 cases of acute respiratory illness caused by exposure to Crania brevis at a Florida beach, and 4 separate outbreaks of swimmer's itch, 2 at Colorado lakes, 1 in a New Mexico lake, and 1 at a California beach. Swimmer's itch, properly known as cercarial dermatitis, is caused by a parasitic nematode transmitted to humans from infected birds via an intermediate host snail. Vibrio wound infections can cause severe illness and complications, including blood poisoning, and require amputation. 9 people died from exposure to Vibrio in 2007-2008. Vibriosis is more common and severe among persons with pre-existing wounds and chronic medical conditions. Good advice for these folks is to refrain from swimming. 8 fatal cases of primary amoebic meningoencephalitis, or PAM, were reported in 2007 and 2008. PAM is caused by Naegleria fowleri, a free-living amoeba that grows in warm freshwater and hot springs. PAM occurs when the amoeba enters through the nose and travels to and infects brain tissue. Little is known to this point about best practices to prevent this illness, but risk reduction strategies could include avoiding warm fresh water when the weather is hot and water levels are low, holding the nose shut or using a nose clip when in those water bodies, and minimizing the disturbance of sediments. Now that we've fully examined the public health significance of water quality, let's turn our attention to how you, as water quality professionals, can best collaborate with your counterparts in public health. First off, in the constellation of agencies and associations, you'll find a typical nesting of federal agencies and state affiliates. Just as the Centers for Disease Control and Prevention, CDC, is nested within the U.S. Department of Health and Human Services, in my state, the Public Health Division is nested within the Oregon Health Authority, a sister agency to the Department of Human Services. Public Health Authority differs between states. In Oregon, authority is held at the county level and managed through the partnership of the Coalition of Local Health Officials. Together, we administer public health statutes and rules in Oregon. Similar to the role of the Association of Clean Water Administrators in state regulation of water quality, we find the Association of State and Territorial Health Officers, ASTHO, and its subsidiary State Environmental Health Directors representing the interests of state-level public health. The National Association of County and City Health Officials, NACHO, provides representation for local public health. The Council of State and Territorial Epidemiologists promotes the effective use of epidemiologic data to guide public health practice and improve health. The American Public Health Association and its state chapters are a forum for a broad array of public health professionals and others who care about individual and community health. I've highlighted here the many components of the U.S. public health system within the U.S. Department of Health and Human Services. This org chart might resemble the org chart of your state departments of health and human services. The agencies of DHHS perform a wide variety of tasks and services, including research, public health, food and drug safety, grants and other funding, health insurance, and many others. The department oversees the delivery of public health and provides assistance to individuals and families through a variety of programs. DHHS provides services through 10 regions, the same 10, in fact, as the 10 EPA regions. You can find support for Healthy Waters activities in several centers within CDC. I've highlighted the centers with the most connection to water quality. You may find similar programs within your state public health agency in the area of environmental health, although state agency organizational structures vary. CDC and your state public health agencies provide epidemiologic and toxicologic assistance, water quality assessment, and laboratory testing during waterborne disease outbreaks. Consult us regarding engineering and environmental health aspects of recreational, and in some states like Oregon, drinking water treatment, and collection of proper water samples to identify pathogenic viruses, bacteria, and parasites. Now, let's go through our last change of gears and coast through some programs that are of particular interest to water quality and public health practitioners. As I already mentioned, about 15% of the U.S. population relies on private wells for their drinking water. Until recently, the U.S. did not have a public health program focused on ensuring the safety of private well systems. CDC's Private Well Initiative addresses public health impacts from drinking water from private water wells and other unregulated sources. This initiative is creating a resource to describe private wells for use by environmental health practitioners. This resource will help practitioners develop and target recommended interventions to protect people from drinking contaminated water from private systems. The interventions may be whole house water filters, filters installed at the tap, or environmental fixes such as well casing repair and modifying nearby land uses. CDC implemented the Private Well Initiative in 2010, first partnering with states and federal agencies along with non-governmental organizations to create a National Private Well Initiative work group, which meets by webinar quarterly. The initiative includes a few states funded to pilot these priorities, and it helps to motivate the development of indicators of private well hazards for the Environmental Public Health Tracking Program. More on that later. EPA's Fish Consumption Advisory Program has, over the years, developed guidance for collecting and assessing fish tissue to determine whether fish consumption advisories are needed, as well as guidance to determine a recommended consumption rate based on the type of fish collected, the pollutant presenting the greatest risk, and the target-sensitive populations. EPA collects fish advisory information from state fish consumption coordinators and publishes a national listing of fish advisories database, which includes all available information describing state, tribal, and federally issued fish consumption advisories in the United States. At the state level, fish advisory work is done in conjunction with environmental cleanup efforts or with other funded fish collection efforts. There is little or no federal funding available to states to carry out this work. What little funding there is available to EPA is at risk of being eliminated from the next federal budget. You're already likely familiar with the EPA beach program. The general idea is to collect and analyze beach water for indicator bacteria and notify the public in a timely manner if levels are high. Sanitary surveys and other water quality assessment methods are used to identify and hopefully correct the causes of pollution. Recent recommendations to revise the recreational water quality criteria for beaches would streamline the standards for indicator bacteria, encourage the adoption of rapid testing methods, as well as the development of predictive modeling so that weather and pollutant conditions can be used to proactively issue advisories. Funding is available for all coastal and Great Lakes states to implement this program, but unfortunately, all funding is at risk of being eliminated from the next federal budget. CDC recognized the gap in public health ability to respond to or even understand the extent of the risks presented by harmful algae blooms, HABs. For the past 4.5 years, CDC funded a cooperative agreement for around a dozen states to track data to characterize freshwater and marine HABs and associated illnesses. The idea was to feed this information into a surveillance system that could be used to estimate the burden of disease from HABs. While the success of that particular effort was limited, the program did serve to bring more coherence to state efforts to address HABs. The program also spun off a group to develop freshwater HAB indicators for the Environmental Public Health Tracking Program and is starting an effort to improve reporting of HABs to the National Outbreak Reporting System. CDC, USGS, and EPA co-host a national HAB work group that holds webinars about once per quarter. CDC funding for this program ends September 30th this year. CDC's Environmental Public Health Tracking Program brings together information about environmental hazards, exposures to those hazards, and health outcomes. 23 state and local public health departments work together to define nationally consistent indicators of environment and health. The program features web portals to provide common query, analysis, and displays of data and information to various audiences. To date, the tracking programs developed environmental indicators of air pollution, public drinking water and housing quality, lead poisoning exposure indicators, and health outcomes related to asthma, heart attacks, cancer, birth outcomes, birth defects, carbon monoxide poisoning, and heat-related illness. The tracking program is developing new indicators, including some related to private drinking water and freshwater harmful algae blooms and related illnesses. Portals and indicators aside, the greatest benefit of the tracking program has been the development of expertise and technology within state public health departments that can be and is used by other public health and environmental programs. To wrap up, I'd like to offer a couple of thoughts on how water quality monitoring and public health work together. I'm borrowing this figure from Oregon's Harmful Algae Bloom Public Health Advisory Guidelines because it encapsulates the roles we play given our expertise and resources. We as public health, don't usually have the ability to collect environmental data ourselves, so we rely on our partners to provide us high-quality data from their collection efforts. We have to work together to define how that data collection activity is to take place. We work best together to interpret the meaning of the environmental data. Public health interprets the public health risk presented by water hazards and takes steps to communicate the health risks to those who may become exposed, as well as to other interested groups. We work together to monitor the environmental public health situation and provide updates to our stakeholders. As always, the water quality monitoring framework brilliantly captures how we can work together to understand, protect, and restore our waters to maintain and improve public health. As we collaborate on developing monitoring for public health purposes, we keep public health risks in mind for our monitoring objectives. As environmental and public health professionals, we understand that water quality monitoring is important to assure safe drinking water and clean waters for fishing and swimming. While we protect our watersheds, aquatic habitats, and species, we're also protecting our kids. What we're doing is creating healthy waters for healthy humans. Thank you very much for your attention.
Okay, thank you very much, Curtis, and thank you all on the phone for participating.